Okay, so this particular patient, just came in routine periodic exam, and one of his concerns was that he'd just been having, he'd been having some sinus troubles. His sinus hadn't felt quite right, and so we took a volume on him, and
Yeah.
as you can see, his sinus is entirely occluded.
Yeah.
In a variety of directions, and so that was nice to be able to just take that sinus view and be able to show him, hey, something is going on. You should probably go and visit your ENT. So he actually went and visited his ENT and got worked up, and the ENT took care of him, and he feels a lot better now.
Yeah, so this is a great example, and I'm curious, what were the symptoms of the patient when they first came in?
Just kind of congestion, pressure in the sinus, where they're
Okay.
just like, yeah, it just doesn't feel right.
Right.
Not necessarily acute enough to move them to action, but if you ask them about it when they're sitting there, they'll be like, oh yeah, something is kind of weird here, but I'm not sure what. Yeah, the right and the left maxillary sinuses are very different in him.
Yes, absolutely. Without the cone beam, this would have been information the patient probably never would have been able to get. And especially given the symptoms weren't necessarily that dramatic, and it probably helped the patient address the issue that, they may not have gotten addressed otherwise.
Yeah, exactly. We've actually had this occur with several patients, and we're starting to form a stronger connection with our local ENTs because they're seeing that we're sending them work that should be done.